Let us now talk about how do we classify hemophilia based on the disease severity. The disease severity is generally related to the percentage of the factor that is at work. Generally, if there is 35 to 40% activation of the factor, then there is not any problem in hemophilia patients. We won't have any symptoms. So the problems start whenever we have less than 30% of the activated factor or the functional factor. Based on this percentage, we have classified hemophilia into mild, moderate, or a severe disease. Let's start off by talking about the severe one first. If the factor level is less than 1%, if there is only less than 1% activation factor that is basically moving around in the blood and less than 1% factor is actively performing its function, then that leads to a severe type of hemophilia. And these are the patients that have spontaneous bleeds. They do not have need to have any type of injury, any type of trauma to get bleed. They will just spontaneously bleed on their own. And that is a very severe disease. These patients require prophylactic treatments. And right from their start in the early life, they can have a lot of problems with the intracranial bleeds. At birth, they can present with the umbilical bleed or the cord bleeding. Later on, just with minor bruises, they can bleed a lot. And this can be life-threatening. So for these patients, we generally recommend prophylactic treatments with the help of the various factors, precipitates, as we're going to talk about in the treatment section. For the moderate disease, if we basically classify it as if the factor level is greater than 1 and less than 5%, so 1 to 5%, if that is the factor level or that is the percentage of the active factor, then we classify it as a moderate disease. And in moderate disease, there are fewer bleeds as compared to the severe factor problems. There are less spontaneous bleeding, but there is traumatic. With trauma, there are large bleeds, like we can have hemarthrosis, we can have intracranial bleeding, and these patients need smaller traumas to have a large bleed. So it is also a relatively severe disease as compared to the mild, which is the general and basically presentation of hemophilia. And for the mild disease, the factor level is generally between the 5 to 30%. And these patients have very fewer bleeds, and they generally bleed after, for example, after an RTA, road traffic accident, or they have a lot of trauma. Afterwards, they'll start bleeding, but the bleeding stops bleeding. It is very difficult to stop the bleeding in these patients. So these have fewer bleeds, and they require a larger impact to have bleeding. And they can have bleeding, for example, after a dental surgery, after various types of extraction of the food. They can have minor GI bleeds. They can have hematuria as well. So based on the factor level, we classify or stratify the hemophilia severity. For the mild disease, the factor is generally, there is around 30% of the factor level. If we have a less than 5% and greater than 1% of the factor level, then that is classified as a moderate disease. And if there is just less than 1% active factor around to carry out its functions, then that is classified as a severe hemophilia, and that leads to spontaneous bleeding and various types of bleeding episodes right from the infancy or their childhood.